Welcome to the first module of the breastfeeding training course. I'm Suman Rao, working in the Department of Neonatology, and today we will discuss the composition of breast milk, the dynamic nature of breast milk, and also we'll discuss the numerous benefits that breastfeeding offers to the human offspring. We all know that breast milk is the ideal food for infants. It has unmatched benefits for both baby and mother, and that is why it is a clinical gold standard for infant feeding and nutrition. It is safe, it's hygienic, and protects the baby from many childhood illnesses. And that is why exclusive breastfeeding is so important. And by exclusive breastfeeding, we mean giving no other food or drink, not even water, except breast milk. Medically indicated drops, syrups, ORS are of course allowed. Breast milk is the only food and drink a baby needs up to 6 months. And the recommendation world over is that exclusive breastfeeding should be done for the first 6 months, and breastfeeding should be continued along with appropriate complementary foods for up to 2 years and beyond. Breastfeeding provides the optimal growth for the baby. And this is because the composition of breast milk is ideal for the growth of the human infant. While we compare human milk and cow's milk, we see that the protein content is almost a third of cow's milk. Now, this is because a human infant grows much more slowly as compared to the calf. Again, you will see that the whey-casein ratio is 80:20 in human milk, whereas it is the reverse in cow's milk. Further, the amino acids which are present in the human milk are adequate for the baby. It has all the essential amino acids for the growth of the baby, and particularly it's important for the brain development. And also the protein is very easily digested and absorbed. The fat content overall is similar, but the human milk has unsaturated fats, which is important for brain growth. And in addition, the sugar content is much more in human milk. That is why human milk is so much sweeter. What is different from human milk and cow's milk is the amount of salt. The amount of salt in human milk is far lower, and therefore the load on the kidneys is less. And calcium, phosphorus are all present in the ideal amount for the human infant. Iron too is the same, but the amount of iron which is absorbed from human milk is much more than that in cow's milk. Enzymes are present and which helps in the digestion of the human milk. And in fact, that is the reason we say that when a baby is on human milk, the baby doesn't need anything else to help digest the food. The vitamins are enough, and human milk is 88% water. No additional water is needed even during the hottest season when a baby is exclusively breastfed. What makes human milk very different from any formula is a huge amount of protective substances which are present in breast milk, and we will talk about that later. And of course, since it comes directly from the breast, there's hardly any chance of any bacterial contamination. So you know that breast milk is not only the best food, but it's also very species specific. We definitely want our infants to grow up on breast milk and not on cow's milk. So it's indeed the best food for the baby, but we need to understand that human milk is much more than food. In fact, I think of breast milk as a living tissue because it has so many bioactive factors, growth factors, immunological factors, which in addition to providing the best nutrition, it offers immune protection, it regulates the growth and development and metabolism of the baby. What makes human milk is so unique are these bioactive factors which are present. None of the best formulas would have any of these things. Human milk has cells like macrophages, stem cells, immunoglobulins, cytokines, and all this helps in immunomodulation and protection of the baby from various diseases, not only during infancy, but throughout life. Similarly, it has several growth factors like epidermal growth factor, insulin growth factors, erythropoietin, and these again promote optimal growth of the baby. There are several antimicrobial factors and like oligosaccharides, mucins, and I would like particularly to talk about the human milk oligosaccharides. This is the second most largest component carbohydrate in human milk. And this human milk oligosaccharide is a very important immunoprotective factor. It acts as a prebiotic, it acts as a decoy and binds to pathogens. And not only that, it also helps in the neurodevelopment of the baby. Lactoferrin is the other very important component which plays multitude of roles. And that's much more higher in human breast milk. It's antibacterial, chelator, antioxidant. And human milk is a live tissue. It has millions of leukocytes and cells. And for a long time, we used to think that human milk was sterile, but now we know that human milk also has bacteria. Human milk is not sterile, but all this bacteria, good bacteria like lactobacillus. And this helps in establishing the microbiome of the baby. And this microbiome, we know, is the largest organ in our body. And this microbiome plays a big role in our health, not only in infancy, but throughout life. So the composition of breast milk makes it unique, and it's not only for nutrition, but it is for neurodevelopment, and it is a very important immunological protective factor. But again, there's another big dimension to human milk. It is very dynamic. It changes over time, it changes during a feed, and it changes as need-based. And if you look at it, the first milk which comes out is the colostrum. Then as the baby feeds, the mother enters into lactogenesis stage 2, and then she has copious amount of milk. But even in this milk, as she feeds, during a feed, the first milk which comes is the foremilk, and this is followed by the hind milk, and you will see that the hind milk has a much higher component of fat as compared to the foremilk. The colostrum is, in fact, the liquid gold. It's the first immunization that we need to ensure that every baby gets, whether it's a preterm, term baby, we need to ensure that the baby gets colostrum. It is high in several immunological factors and growth factors, and it's very small amount. It is concentrated, and that's enough for the baby. So ensure that every baby gets colostrum in the first hour of birth. And you see here, it is so high in secretory IgA and lactoferrin, and this comes down rapidly after birth. The second important factor which makes breast milk so dynamic is the fat. The fat is the most variable component in breast milk, and shorter the duration of gestation means if a baby is born preterm, the amount of long chain polyunsaturated fatty acids is more. And that's so beautiful because the preterm baby requires more unsaturated fatty acids. Similarly, even if the volume is low, it has higher fat content. If a mother is malnourished, or if her dietary intake is poor, yes, the fat content in her milk may be lower, but this is made up by the higher volume of the milk that she will produce. So the fat is variable, and it also changes, as we saw, between foremilk and hind milk, and it is just right for the human baby. So this is something that we often use when we take care of small babies, especially the preterm babies. We try to offer them more hind milk so that the calorie content is higher and they gain weight faster. The amount of research which goes into breast milk even now is huge. We are learning new fantastic aspects of breast milk daily, and this is one of them. It is now known that breast milk provides circadian cues from the mother to the baby. It helps establish a circadian rhythm, and babies who feed the fresh breast milk, the circadian rhythm gets established much better. Such babies, the duration of hospital stay and all is lower. So even in the NICU, it is better to give the baby fresh milk because that is synced with the circadian rhythm of the baby. We all know that preterm milk is the best food for the preterm baby. And this is one of the main reasons. This is a very old slide, but I love this slide because it shows very clearly that the protein content is almost double that in a full-term milk. And if you see the other things which are higher in preterm milk are sodium, iron, vitamin A, which are all very important for the preterm baby. It's not only that the preterm milk is higher in protein, but it's also gestational age dependent. From this figure, you will see that lower the gestational age, that is a baby who is very preterm, say a baby who is born at 23, 29 weeks, has much higher level of protein, and this remains high for a much longer time. And this is of great importance to the preterm baby because the preterm baby has to gain weight faster. In addition to the proteins, we know that iron is more, vitamin A is more, zinc, sodium. Again, these are all matching the requirements of the preterm baby. So what we have learned is that not only is breast milk species specific, it is baby specific. So all preterm babies should receive mom. And what do I mean by mom? Mother's own milk. Especially in this era where there are many breast milk banks, it's not enough to provide human milk. It is very important to provide mother's own milk. So now I would like to think of the mother and the baby as not just a diet, but mother, breast milk, and baby as a triad. And we as health professionals need to ensure that every baby gets breast milk. This is again a very old slide. This is from the Lancet Survival series of 2004. But I would like to highlight from this that the most important intervention that we have even today to reduce under 5 deaths is breastfeeding. In fact, the number of deaths that breastfeeding can avert, that is shown here as 13%, is far higher than any other intervention. And that is what makes breastfeeding such a life changer. If you look at the benefits, it's a complete nutrient, easily digested, efficiently used, protects against infection, protects against long-term non-communicable diseases. And of course, it costs less than artificial milk and helps bonding and development. This is a slide from the WHO Essential Newborn Care, which shows 10 good things that you need to know about exclusive breastfeeding. A good slide to have in your wards. Exclusively breastfed infant is less likely to die of diarrhea by 14 times, less likely to die of respiratory diseases by 3.6 times, and less likely to die from any other infections by 2.5 times. Huge benefit in saving lives by exclusive breastfeeding. So it's a complete food. It's available in the right quantity at the right time, easily digested and well absorbed, hygienic, protects against illness, promotes emotional security, and it's very important for social development. And it's not only important for survival, it's important for intact survival and improving the IQ of the baby. It is an important infection prevention tool. As we see here, it protects against diarrhea, respiratory infections, otitis media, necrotizing enterocolitis, dental caries. And in fact, in the NICU, we all know that we struggle often to provide breast milk to the baby, but don't be disheartened. Even if you're able to increase the breast milk available by 10 ml per kg every day, you can be assured that this has benefits to the baby and the risk of NEC, risk of hospital readmissions is reduced. This slide shows that the benefits of breastfeeding is lifelong. Breastfeeding is an important protective factor against obesity, diabetes, coronary heart diseases, hypertension, celiac disease, inflammatory bowel disease, cancers, allergies, caries, otitis media. In this era where obesity is rampant, exclusive breastfeeding for 6 months reduces obesity by 15 to 30% later. For every month of breastfeeding, there's 4% reduction in obesity. And therefore, we need to fight against obesity by promoting exclusive breastfeeding. Allergic disorders are far lower in the exclusive breastfed infant. In fact, a lot of moms who themselves have asthma or there is a family history in a sibling, they ask, what can I do to prevent asthma in this baby? Breastfeeding is one big intervention. It reduces asthma risk by 26 to 40%. Similarly, celiac disease by 52%, atopic dermatitis by 27 to 42%, and type 1 diabetes by 30%. And these benefits are greater when there is a family history. So do ensure that all your families who have these problems, you're going to support breastfeeding even more. SIDS, or sudden infant death syndrome. Breastfeeding reduces the risk of SIDS by 45%, and if they're exclusively breastfed, the reduction is huge. Major diseases like leukemia are reduced with exclusive breastfeeding. And very importantly, breastfeeding is the best way to get the brain to grow well. It has all the components which helps in brain growth, like galactose, DHA, amino acids. We know it's the best form of developmentally supportive care. And it also promotes normal behavior. In this era where behavioral issues are so rampant, there are so many social issues, breastfeeding is a way we can fight all these problems too. It makes the child more confident, it helps in self-regulation, and it's been shown that exclusively breastfed infants go on to become adolescents with less psychopathological problems, less aggression problems. Here I'm going to talk about two studies in preterm babies, which was done in Europe in the 90s. And we have two cohorts at the epiphage and the lift cohort. And here they followed up these babies for up to 2 to 5 years. And then they saw breastfeeding status and weight gain, and also looked at the neurodevelopment. What they found was that babies who received more breast milk, they did not grow very well. The weight gain was lower. But despite that, the neurodevelopment was much better. And if you see this graph here, you see that those who are not breastfed, did not receive any mother's milk, has the least IQ, whereas those who were breastfed at discharge and weaned much later had higher IQ. But their growth was lesser, and this is known as the apparent breastfeeding paradox. So very often, families ask you, my baby is not growing well, should I give something else? And this is what you need to talk about. For every 10 ml per kg per day of human milk ingestion, the scores of the brain improves. This is another slide which shows that exclusively breastfed preterm infants, as they grow into adults, their heart is normal like any other adult who was a term baby. Whereas a preterm infant who was fed on formula, their heart and cardiac morphology is very different. Again, to show that what you do in the first 2 years of life has immense benefits lifelong. In fact, we know that India is a diabetes capital, but breastfeeding is again one more way we can fight that. By exclusive breastfeeding, the type 2 diabetes risk is reduced by 40% and adult obesity by 24%. So huge benefits to the baby in infancy and lifelong. In fact, that's why I tell all moms, the best welcome gift you can give to your baby is by exclusively breastfeeding your baby for 6 months and continuing to feed your baby for 2 years and beyond. But there are also immense benefits to the mother, and we need to talk about it. We know these things. These are, again, things which have been known for decades now. We know that oxytocin contracts the uterus, so the first feed itself helps in controlling the bleeding after delivery. Exclusive feeding for 6 months is a good protection tool against pregnancy. It decreases so much of workload to the mother. It helps regain figure, because this is something, again, we need to talk about, because many moms think that breastfeeding will affect their figure. And it lowers the risk of problems like breast and ovarian cancer to the mother. So when you initiate breastfeeding, there is immediate benefits to the mother. PPH risk is reduced, the uterus involutes, it helps in postpartum weight loss. In fact, one other important thing is it reduces postpartum depression, which we know is a hidden problem in our setup. It delays ovulation, and it's a family control tool, family planning tool. Again, by continuing breastfeeding, it helps her regain her figure, decreases weight loss, it prolongs lactational amenorrhea, and it reduces her risk for type 2 diabetes, cardiovascular risk, and cancer risk. We have a lot of GDMs, and one thing that we can tell them is, by exclusively breastfeeding your baby, your chance of becoming a diabetic is much lower. Even various immunological problems like rheumatoid arthritis are also reduced by breastfeeding the baby. In fact, a lot of these have dose-dependent benefits. It is based on the reset hypothesis. So in type 2 diabetes, the risk reduction for every year of breastfeeding is 4 to 12%. Cancers are also reduced 4.3% risk reduction with every year of breastfeeding, and similarly 28% reduction for every year versus no breastfeeding for ovarian cancer. There are a lot of benefits to the family. Saves money, saves time, healthier baby, better IQ, saves energy, and is therefore important for the entire society. It is in this, it's very green. It is green to breastfeed. And as I said, it is the number one tool to reduce infant and child mortality. And when we give intelligent babies, of course, they are the nation's wealth. But breastfeeding is not only for 6 months. Even in the second year, when a baby is well into complementary feeding, there are several benefits of breastfeeding. Even in the second year, breastfeeding contributes to around 35 to 40% of the energy requirements of the baby. It's a very important source of essential fatty acids and of vitamin A, calcium, and other vitamins. It protects against illness, and even during illness, it is probably sometimes the only food that a baby is ready to take. So continue breastfeeding for at least 2 years, and then it is up to the baby and the mother to continue for as long as they wish. So in conclusion, breast milk is the best. Mother's own milk is the way to go, and we have to make it happen. Thank you very much. And if there are any questions, we will take it up in our chat session on Telegram. Thank you.